everyone, welcome to my channel. Let's talk about cancer. In this video we are going to talk about cancers of the oral cavity which are sitting on or invaded into the bone of the lower jawbone or the upper jawbone, requiring the cutting or removal of a part or the whole bone, so which is part of the treatment for oral cancers. When oral cancers are sitting in the gap between the cheek and the bone, over a period of time they get fixed onto the bone, then they invade into the bone and cause destruction of the bone. This requires removal of the bone called as the mandible or the maxilla based upon which bone it has involved. So the problem with removal of the bone is we will not be able to chew. For us to be able to chew food, we need the entire bone intact. Removal of part of the bone will make it impossible to chew any hard food. So this occurs in several ways. If the tumor is close to the bone or maybe sitting on the bone but the bone is not involved, we can spare this bone and remove only a part of the bone, leaving behind a thin amount of bone so that the bone's function is retained and they can still chew. If it has invaded the bone through and through, then we can cut that piece of bone, put a plate, and then put a piece of bone from the leg or from the hip, reconstructing the jaw, thereby making sure that even though bone is removed, a different bone is put in place so that the function of chewing is retained. Similarly, if the upper part of the jaw has to be removed, the upper jawbone has to be removed, then there will be a gap connecting it between the mouth and the nose. So whatever we take will try to come out of the nose. A simple way to prevent this is just to put a plate called as an obturator, but that is very painful because we have to remove it and put it again at every meal. There are many flaps which we can put to cover this and create a separation between the oral cavity and the nose, so that even though the bone is not there, the function of mouth and nose are separate, so chewing is still possible. So these are the different bones that need to be cut and how they can be reconstructed to make sure that the normal function of chewing is maintained. Thank you.